Welcome to today's presentation on educating the child that has been recently diagnosed with sickle cell anemia and their parents. We will explore key aspects of the disease, ways to manage it, and offer educational tools to ensure better understanding and care. The NCLEX RN detailed test plan content categories include management of care, health promotion and maintenance, pharmacological and parental therapies, and reduction of risk potential. The slides that the information on is listed below. First, our learning objectives for the child are going to be to understand what sickle cell anemia is and how it will affect their body. We're going to teach them how to recognize the signs and symptoms of a sickle cell crisis. And we're going to identify healthy habits that help to manage their condition. And we're going to teach them how and when to seek help when they need it. For the parents, we will focus on understanding the long-term effects of sickle cell anemia, learning how to manage and prevent complications for their child, how to recognize complications are occurring and knowing when to seek urgent care, how to support their child's education and social interactions, and finding resources for emotional support and ongoing education. Understanding what sickle cell anemia is. Sickle cell anemia is a genetic blood disorder that affects the shape of red blood cells. Instead of being round, the cells are crescent shaped and stick to themselves and the vessel walls, which cause occlusions. So this blocks blood flow, causing severe pain and tissue damage due to the lack of oxygen to tissues and organs. Whereas sickle cell disease is inherited from both parents need to have either a sickle cell disease or carry the single cell trait for the child to inherit the condition. Sickle cell is a mutation in hemoglobin, which is the protein that's responsible for carrying oxygen in the blood. It's important to differentiate between sickle cell disease and sickle cell crisis. Sickle cell disease is the overall condition that causes chronic health challenges due to sickle-shaped cells. Sickle cell crisis is a painful episode where the sickle-shaped cells block blood vessels, reducing oxygen flow to tissues and organs, and leading to intense pain and possible complications, which we'll discuss later. Key symptoms that a sickle cell crisis is occurring can include pain episodes, which often are called sickle cell crisis. This occurs when sickle cells block blood flow, depriving tissue and organs of adequate oxygen. Anemia can cause fatigue, weakness, and pale skin due to a low red blood cell count. Frequent infections occur due to the sickle-shaped blood cells causing damage to the spleen, which is an essential organ when fighting infections. It can cause low immunity function, leaving the children more vulnerable to infections. And swelling in the hands and feet, delayed growth or puberty, and jaundice. This is due to chronic anemia and reduced oxygen delivery to the tissues. The signs of a sickle cell crisis include severe pain. This is the number one common symptom of a sickle cell crisis. That severe pain can be in the chest, back, arms, or legs. This is caused due to lack of oxygen to the tissues. Also called a vaso-occlusive event. Swelling in the extremities, which is also indicative of blood flow blockage. Difficulty breathing, fever, pale skin or lips. And if any of these symptoms appear or occur, immediate medical attention is required. Sickle cell anemia can lead to several serious complications. Pain crisis or a vaso-occlusive crisis causes extreme pain in your bones, chest, abdomen, and joints. Infections are more common due to the damage to the spleen. A stroke can occur when blood flow is blocked to the brain. Organ damage can occur in the liver, kidneys, heart, and lungs due to lack of oxygen. Acute chest acute chest syndrome, which is a life-threatening emergency, happens when the sickled blood cells block small blood vessels in the lungs, which leads to reduced blood flow and oxygen delivery. Splenic sequestration happens when the spleen traps sickle cells, leading to severe anemia. We can manage and reduce sickle cell crises by adapting healthy habits. So we want to teach good hand hygiene, especially hand washing to help prevent infections. Hydration is a key to prevent dehydration, which can trigger a crisis. Avoid extreme temperatures and high altitudes to prevent crises. Extreme hot and cold can trigger a vaso-occlusive event, and high altitudes have lower oxygen in the air, and that can trigger a vaso-occlusive crisis. Regular medical checkups are imperative to monitor the disease. Pain management. You want to recognize early signs of a crisis and use prescribed pain relievers. Ensure the child is up to date with their vaccinations to avoid dangerous infections. A few examples would be influenza, Hep B, and pneumococcal vaccines. Encourage healthy nutrition to maintain overall health with a balanced, nutrient-rich diet that's focused on colorful fruits, colorful vegetables, whole grains, and lean proteins. Some medications used to treat episodes of sickle cell crisis are blood transfusions, IV fluids, which are usually normal saline or 5% dextrose with saline for hydration, antibiotics for active infections, and analgesics for pain relief. They range from ibuprofen for mild pain up to morphine for severe pain. Some medications that can be used to reduce episodes of sickle cell crisis are crizanlizumab, which slows or stops red blood cells from sticking to each other and to the inside of blood vessel walls, helping to decrease vaso-occlusive occurrences. L-glutamine can help to reduce oxidative stress or damage to red blood cells, decreasing the occurrences of sickle cell crisis. And hydroxyurea can help to reduce pain crisis and complication occurrences by increasing the size of the red blood cell, which helps them to stay round and more flexible by increasing the hemoglobin F, reducing occurrences of the sickled shape. To ensure the child understands this disease, we're going to use age-appropriate language and visuals, like diagrams of red blood cells. We're going to utilize games, stories, and videos to explain how blood flows and how sickle cell causes pain. We're going to reward the child with positive feedback and prizes. You want to practice role-playing scenarios where the child can identify a crisis and ask for help, and discuss the importance of communicating with teachers or their school nurse when they're not feeling well. To reinforce our education for our parents, we want to provide written resources on sickle cell anemia and complications, help to create a care plan for the school nurse and ensure that the school staff is informed about the child's needs, discuss genetic counseling for their future family planning, and offer support groups and emotional resources for ongoing education and coping strategies. To assess the child's knowledge and understanding of their disease, we're going to ask them to explain what sickle cell anemia is and how it affects their body. We're going to have them describe symptoms of a crisis and what actions they should take. And we're going to use drawings or verbal descriptions to assess their knowledge. For the parents, we're going to assess their knowledge by asking them to demonstrate their understanding of the disease and how to manage their child's care. And we're going to provide a questionnaire for them to take to assess their knowledge on recognizing complications and when to seek urgent medical attention. In summary, It is essential for both children and parents to understand sickle cell anemia, to recognize the symptoms of the disease, and take proactive steps to manage and prevent complications. By providing ongoing education, support, and resources, we can help improve the quality of life for children with sickle cell anemia and empower parents to advocate and make informed decisions for their child's health. So, for review, we'll do a couple of NCLEX questions. A 10-year-old child with a history of sickle cell anemia is in the emergency department with symptoms of a sickle cell crisis. The nurse assesses the child for signs of complications. Which of the following findings would most likely indicate a serious complication that requires immediate intervention? Select all that apply. The correct answers are A, B, and C. Severe pain is the number one early indicator of a vaso-occlusive event. Pale skin and lips combined with fever could indicate a possible infection. And swelling, especially in the extremities, could indicate a blockage in blood flow. Which of the following interventions should the nurse include in the care for a child with sickle cell anemia to help prevent a sickle cell crisis? We're going to instruct the child to avoid extreme temperature changes. Exposure to extreme temperatures, both hot or cold, can trigger a sickle cell crisis. A child with sickle cell anemia is being treated with hydroxyurea. Which of the following is the primary therapeutic benefit of this medication? The correct answer is A. Hydroxyurea increases the size of red blood cells, making them more flexible and helps them pass through the vessels without sticking to each other. So thank you for your attention during this educational presentation, and I hope you all learned a little bit more about sickle cell and how to help your patients when you come across it.